But first, a Keep 'Em Honest report you'll only see here. A year-long investigation by CNN and the Center for Investigative Reporting found widespread fraud in California's drug rehab program, a drug rehab program that receives hefty amounts of federal taxpayer dollars, also known as your money, obviously. As a result of our investigation, more than 100 drug rehab centers were suspended with their funding cut off, and others were completely shut down. But tonight, our investigation continues, and it goes beyond just the clinics. It looks squarely at the doctors who serve as medical directors for the clinics. One doctor in particular is medical director at more clinics than anyone else. But as we discovered, under the law, he doesn't actually have to see any patients. That's right, he doesn't have to see any patients at all. But he has found a way to make a lot of money off the whole thing. Here's investigative correspondent Drew Griffin.
This is another group room.
When we first met Dr. Howard Oliver this past January, he had every intention of telling us and showing us just how much good taxpayer-funded drug rehab clinics do in Southern California.
It's gonna get better. Be patient.
Where at places like West Coast Counseling Center and other clinics throughout Southern California, Oliver has been the physician overseeing the treatment of close to 2,000 patients.
So you're the medical director?
Medical director.
And what does that mean in terms of your responsibilities?
It means I'm responsible for assuring that they have a quality medical assurance, that our referrals are for, I give referrals for medical care. I ensure that they're able to undergo treatment here.
At the time of our interview, we questioned just how that could be physically possible, that one man could essentially care for nearly 2,000 people at 19 clinics. In fact, Los Angeles County had been wondering the same thing about Dr. Howard Oliver in the past, especially when his name, or more specifically his signature, kept coming up again and again on blank medical forms. A practice a former state official found opens the door to potential fraudulent billing practices.
Records show you were medical director for Immaculate Care in Los Angeles.
Immaculate Care, yes.
That owner convicted of fraud. During the investigation, a counselor says you signed off on stacks of medical records without reading them.
Well, that's not true.
It's not true?
No.
That was a lie.
Yes.
You don't sign off on stacks of medical records.
I sign off on stacks of medical records, but I review them.
You do review them?
Yes.
Oliver says his signature on the blank forms were forgeries. Oliver's signature is worth a lot of money. It is needed for drug Medi-Cal clinics like these to submit bills to the county and state for reimbursement. And for that signature, Oliver's paid pretty well, up to $1,500 a month, he told us, for the clinics where he's been working. But since this interview in January, his business has gone bust because of this.
I don't. Wait a minute now. We have to give.
Just 1 second, sir. Did he call back and say he's not coming?
This past July, CNN and the Center for Investigative Reporting exposed widespread fraud in the nation's largest Medicaid system. We found that in the last 2 fiscal years, half of the nearly $186 million spent for drug Medi-Cal, about $94 million, went to clinics that have shown questionable billing practices or signs of fraud. California has now suspended 132 clinic locations that were being run by 56 clinic headquarters. 14 of those 56 clinic headquarters have the same medical director, Dr. Howard Oliver. One called Able Family, run by a convicted felon that we revealed in our investigation.
Well, you can explain, how can a guy with a record like you be operating a drug rehab clinic here in California? I mean, you've been convicted in a major insurance car crash scheme in Texas?
I was convicted, but it's not what it seems.
Oliver says he didn't know and isn't expected to know the background of the people he works for. Able Family, meanwhile, has shut down. Among the allegations against the drug rehab industry from our series, that bills were submitted for patients that do not have addictions, for patients that did not receive treatment, and for patients that did not even exist. All treatments that would have been approved and signed by a doctor, including all the patients at Immaculate Care. where Rosaria Falconer was an intern counselor for 5 months, and the medical director overseeing the patients was Dr. Howard Oliver.
What was he signing?
Treatment plans. In order for us to receive the money for the clients, he has to sign the documents saying that he's read over the material that we've put down.
Do you think he'd sign just about anything?
I know that he signed whatever we put out there.
No matter what?
Even if it was wrong. If it was a wrong name on a wrong file, he would sign it.
Immaculate Care, suspended by the state, has shut down. Rebecca Lira, former deputy director for California's Department of Alcohol and Drug Programs, was suspicious about Dr. Howard Oliver after learning about the blank forms with his name on them. She even filed a report on him 6 years ago, when at the time, Lira's report claimed Oliver was medical director of 69 clinic locations, overseeing treatment plans for more than 2,200 patients.
And you found that troubling, to say the least?
Well, we had questions about that, and that's why we were asking the medical board for direction.
What happened? Our investigation found nothing.
When we found situations such as this, we would send it to Department of Healthcare Services and Department of Justice, and they're the ones that are going to determine if there's going to be any further action on that.
The one person who still says he didn't see or know of any wrongdoing is Dr. Oliver, who met us again just this month at West Coast Counseling, one of 14 clinics he's associated with that have been sent a letter like this by the state ordering them suspended.
The letter that you just showed me said one of the reasons this particular facility has been temporarily closed down, lack of medical supervision.
Yes.
You're the medical director.
Dr. Oliver is in fact a very busy doctor. He runs a private practice, has been medical director at dozens of rehab clinics, and also has found time to appear on TV shows.
A 200-degree environment, you would only survive a matter of just a few minutes.
Including as a frequent guest on CNN's sister network HLN as a medical expert for Nancy Grace. How he handles all this while overseeing the drug rehab of thousands of California drug Medi-Cal recipients is easy, he explains. He doesn't actually see most of the people getting treatment, who he says are clients, by the way, not patients. And he even admits he wouldn't know if they are real, or as fraud investigators call them, ghost patients.
You're helping these clinics bill the state for ghost clients.
Well, I don't know that they're ghost clients.
Exactly. So what is your point of being the medical director here if you don't even know that these clients are real people?
Well, you're sounds like you're asking me to be the police here. I'm not the police.
I'm asking you.
I've got certain duties.
You're a physician, right?
Yes.
Physicians treat people?
Yes.
People are real and they breathe air.
Right.
But these clinics are billing for people who are not anything.
I don't have a duty to see every client that comes in here and to question every client that comes in here and to investigate every client that comes in here.
Sounds like you don't have a duty to investigate any of them. You just sign off on paperwork.
I don't have a duty to investigate. That's true. I have certain duties that I have that are prescribed by law, and I do those duties.
So basically, you're looking at paperwork and you sign it if the paperwork looks okay.
Basically, that's true.
You're a clerk. You're not a medical director.
I'm not a clerk.
I mean, what else? There's no point.
Well, that's your definition.
What's your definition? Seriously, you as a physician could be signing a treatment plan for somebody who does not exist.
Well, I don't know that they don't exist. Again, I do what the law requires me to do.
Drew, so Dr. Oliver, he's not breaking the law.
No, the law allows him to do what he's doing, Anderson. Nowhere does California law state a medical director who's giving these people treatment ever needs to see that patient, even if it's just to make sure that a patient actually exists. And we should also point out some of these clinics aren't rolling over so easy either. As we said, 14 of the 19 clinics where Dr. Oliver has been medical director are now suspended, including the one where we did this latest interview, West Coast Counseling. That clinic is fighting its suspension for what the state says is a lack of medical oversight, missing treatment plans, and apparently manufactured documents.
And what does the state say about Dr. Oliver?
Well, over the years, the state has taken what they claim are multiple actions against him, resulting in substantial fines. At one point, he was even suspended from the state's Medi-Cal system. It hasn't really stopped anything. We're told there's going to be a big change coming in January when these medical directors, like Oliver, will have to enroll as Medi-Cal providers. That, Anderson, supposedly will subject them to much more oversight. And speaking of oversight, tomorrow in Sacramento, California lawmakers are going to be grilling the bureaucrats who've been running this program, asking them the questions that we've tried to ask. How could you know or suspect so much fraud is and has been going on and done so very little to stop it?
It's unbelievable.